It's open.
Hi, Ms. Strom. I'm Devin. I'm your student nurse practitioner for today. Before we start, I'm going to go ahead and wash my hands. Okay, what we're going to do here today, we are going to do a head, eyes, ears, nose, throat, and mouth assessment. Okay, the first thing we're going to do, we're going to just look at your head. Okay, so we're looking. Our head is even. There's no bumps, no lumps. It's symmetrical. Your ears are symmetrical, in line with your eyes. Your eyes and nose are all in the middle of your face. Okay, so now what we're going to do, I'm going to put my hands in your hair. So I'm going to feel around. There's no lesions. We've noticed no dandruff, no plaque. There's no nits, no lice. Her hair is thick and evenly distributed. Is there any pain in your scalp?
Mm-mm.
Okay, if you could set your head up. Now I'm going to feel on your face. You tell me if there's any pain.
No.
No pain?
Mm-mm.
Okay, great. Now I'm going to feel on your sinuses. Any pressure, any pain?
No.
Okay, your frontal sinuses are good. What about right here?
Mm-mm.
Your maxillary sinuses are good. From here, we're going to go to your jaw. We're going to test your temporomandibular joint, if you can open and close your jaw. Okay, was there any pain with that? And there's no clicking or no grating, so that's perfect. From here, we're going to go to your lymph nodes. These are your pre-auricular lymph nodes, your post-auricular lymph nodes, your occipital lymph node, your tonsillar lymph nodes, your submandibular, and your submental. Okay. From there, we're going to go down to her throat and feel her superficial cervical lymph nodes, her cervical chain, and her posterior cervical lymph nodes. And then right here, you will have her supraclavicular lymph nodes, and none of these nodes have been swollen or inflamed. They're non-palpable, which means there's no infection there. Okay, so I'm going to go from behind. I'm just going to feel right here. I'm checking your thyroid, and it's not palpable. There's no goiters. So if you can do me a favor, and if you could swallow, and I can feel her isthmus moving up and down, so that is perfect. Okay, from here, we are going to go to your ears. Okay, the first thing I'm going to do is called the whisper test. So I'm going to go behind you. I need you to cover one ear. I'm going to whisper something, and then I need you to tell me what you hear.
Apple.
Okay, and cover the other ear.
Banana.
Perfect. All right, now we are going to do a little test with our tuning fork. This is going to test your cranial nerve 8. What I'm going to do is first is the Weber test. I'm going to hit it on my hand and put it on your frontal bone. When I do that, I need you to tell me if you hear it more in one ear or the other, or if they're both the same. Okay?
They're the same.
Okay, great. Now we are going to test, do a Ryan's test. What I'm going to do is hit it again. I'm going to put it back here on your mastoid bone. When you stop hearing it there, I'm going to move it to the front, and you tell me when you stop hearing it there, okay? And we're going to test both sides. I'm watching on my watch.
Okay. Okay.
Okay, great. Moving to the other side. And again, tell me the same thing, okay?
Okay. Okay.
Great. So her air conduction, which was out here, versus her bone conduction, which was back here, should have been twice as much, and it was. So that is all of that. We are now going to go ahead and look in her ears. First, we are going to look on the outside of her ears and notice that there's no lesions, no cauliflower ear. They're symmetrical. Her tragus is intact and it's movable. Is there any pain with that?
Mm-mm.
Okay, and her pinna is soft and flexible. So there's no drainage noted, so we're going to go ahead and look inside the ear. We're going to pull up on the pinna and look inside the ear. Her auditory canal is pink and intact. There's no lesions noted. Her tympanic membrane is pearly gray. It's neutral. There's no bulging. There's no fluid noted. You can see the cone of light at 5 in her right ear. Okay, so we're going to move around to her left ear and do the same thing. You can see that her tragus is soft and movable. Her pinna is soft and movable. So we're going to look, there's no drainage. Now we're going to go into the ear. Auditory canal is pink and intact. Her tympanic membrane is pearly gray. It's not bulging, it's neutral. The cone of light can be seen at 7 o'clock. So that is all completely normal. Now that we are done with her ears, we are going to go ahead and go to her eyes. We are going to test your cranial nerve 2 first with the Snellen chart. What I need you to do is look straight ahead at our Snellen chart, which is 20 feet away. Close one eye and read the smallest line you can see.
CFHG 0.
Okay, perfect. Now with the other, cover the other eye and do the same thing.
CFHG 0.
Perfect, okay. She was able to read the 20/20 line, which means that her vision at 20 feet is the same as the normal eyesight at 20 feet, so that's perfect vision. Now we are going to test your convergence. What I need you to do, convergence of your pupils, what I need you to do is look straight ahead, focus on something in the distance, and then you're going to look at my finger. What we are looking for is that her pupils, when she's looking at a distance, are dilated. When she looks back at my finger, they constrict. So if you'll do it one more time for me, look far ahead. Now look at my finger. And they do constrict. Her convergence is normal. Now we're going to test her peripheral vision. What I need you to do, I'm going to be moving my fingers, and when you see them come into your peripheral vision, you say now. Okay?
No.
Okay.
No. No.
Perfect. So her peripheral vision is intact. Now we are going to test her direct and consensual pupil constriction. And we do that by looking straight ahead. I'm going to shine a light in your eye and we're going to see if your pupils constrict together. And they do. And one more time. And they have both constricted. Her pupils are equal, round, reactive to light and accommodation. So that is perfect. We are going to check your cranial nerves 3, 4, and 6. With this, I just need you to stare straight ahead. I'm going to move my finger, but I only want your eyes to follow, okay? So right here, just follow with your eyes. Great. And can you lift your eyebrows up for me? Her cranial nerve 3, 4, and 6 are all intact. Now that we've done that, we are going to go ahead and look in her eyes. What we're going to do is I'm going to look in your right eye with my right eye. I'm going to brace myself with my hand up against your the back of your head so we don't bonk each other, okay? So look straight ahead. We're going to come in at an angle until we see the red reflective light. Once we see that, we are moving in and walking it around. We are following her arteries and her vessels, which are paired together down to her optic disc, and it is creamy and a yellowish white color, and lateral to that towards the nose we are seeing the macula. So we're going to do the same thing on the other side, left eye to left eye, bracing ourselves, coming in at an angle till we see the red light, moving in and walking around, following those vessels all the way down to the optic disc, which is again a creamy whitish yellow color. Lateral to that, we are seeing our macula, which is just a little bit darker color. Great. Okay. From here, we are going to look in your nose, okay? First, we're going to look on the outside of the nose. Notice that it is midline in her face. It's in between her eyes. It doesn't look like she's had any breaks or fractures in her nose. So we are going to turn on our light. Lift the tip of her nose up and look inside. Her mucosa is pink and moist. Her turbinates are intact. There's no edema to them. And her septum is non-deviated. And we're going to look on the other side also. In her nose, it's pink and intact. It's moist. Her turbinates are intact. They're non-edematous. And her septum is non-deviated. So that is good. We are now going to test her cranial nerve 1 with smell. So I'm going to open this up. If you'll close your eyes, close one nose, and tell me what you smell. All right. If you can close the other nose. Alcohol. Perfect. So her cranial nerve 1 is intact. Moving on to our mouth. We noticed on the outside of her mouth there's no fissures, there's no tears, there's no lesions, no bumps, no crust. They're pink, moist, and intact. So if you can just open your mouth up for me. We're looking inside, looking at her dentition. There's no caries, no caps, no crowns. Normal dentition. If you can move your tongue around, that is cranial nerve 12, that she can move her tongue around. If you'll lift your tongue up, and we see that the frenulum is intact. Okay, now if you can stick your tongue out and say ah, like you're in Vegas. Ah. All right, that is your vagus nerve. Nerve 10, her uvula and her soft palate move up at the same time, so that is great. We've noticed her hard palate, there's no sores, there's no openings, nothing like that in there. Okay? Okay. We're going to look. Ooh, tonsils. Open up one more time, stick your tongue out. Okay, her tonsils are intact, they're non-edematous, they're 2+. Her posterior pharynx is pink, it's moist, there's no cobblestone noted. Great. The last we are going to do with you is test cranial nerve 9. This is the last one of the mouth. So what I need you to do is close your eyes, and you are going to tell me what you taste that I put on your tongue. Okay? Salt. Okay. And now we are going to test her gag reflex, which is also cranial nerve 9. So it might gag you a little bit. Stick your tongue out. Okay. Did it gag you? Perfect. All right. Last thing we're going to do. Can you puff out your cheeks for me? Okay. Cranial nerve 7. Can you grit your teeth together? Cranial nerve 5. So all of our cranial nerves are intact. That is the end of my assessment. Do you have any questions? Beautiful.